Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillahir Rahmanir Rahim. We have 9 lectures regarding inflammation, then followed by repair and healing. We start with the first lecture of inflammation, and the objectives of this lecture are to understand the concept of inflammation, its types, causes, aims and function of inflammation, and the main component of acute inflammation. Inflammation is defined as a protective response of vascularized living tissue to local injury. The tissue must be alive and vascularized in order to get inflammation. Inflammation is a Latin word, means to burn, but it is not for the actual concept of burning. Inflammation or inflammatory response is the series of changes occur in the tissue that result in response to injury resembling to the burn, but it is not for the actual concept of burning. Any inflammatory response occurs in the tissue, includes inflammation, then followed by repair and healing. Any inflammation occurs in the tissue or organ is usually followed by repair and healing of injured, damaged tissue or organ. As we said, inflammation is a protective defense mechanism of the body to local injury. But sometimes inflammation and repair may be harmful to the body, as causing hypersensitivity reactions. All types of hypersensitivity reaction are regarded as a harmful effect of inflammation. Also, inflammation may cause progressive organ damage and scarring as a result of healing. Causes of inflammation. The most common and important cause of inflammation are infections such as bacterial, viral, parasitic, and fungal infections. Physical agents such as exposure to the heat, as in burns, or exposure to the cold, as in the frostbite, and exposure to the radiation. Chemical agents such as intake of strong acid or alkaline, drugs, toxins, and alcohols. Hypersensitivity reaction, as in cases of rheumatic fever and glomerulonephritis. Tissue necrosis, as in infarction. In myocardial infarction, the infarcted or necrotic tissue is surrounded by inflammatory reaction. Trauma and stress, any type of trauma to the body, such as road traffic accident and others, causing inflammation. Foreign body, presence of the foreign body in the tissue, causing inflammatory reaction. The aims and functions of inflammation. As we said, inflammation is essentially a protective and defense mechanism in the body, and it is regarded as one type of innate immunity in the body. The functions of inflammation are to localize and eliminate the causative agent, to isolate injury and limit tissue injury, and prevent the spread of injury within the tissue, to destroy the invading microorganism by a process of phagocytosis, to dilute, inactivate, and neutralize toxins that are produced by the bacteria or microorganism. Finally, to repair and heal the site of injury that is damaged by inflammation. The inflammatory nature of a lesion is usually indicated by the suffix "itis," when you read the term or word that ends with suffix or section itis. This word means inflammation of tissue or organ by using either conventional term or Latin term, such as inflammation of the appendix is called appendicitis, of the colon colitis, larynx laryngitis, testis orchitis, ovary or ovaritis, bladder cystitis, bone osteitis, muscle myositis, bone marrow osteomyelitis, breast mastitis, joint arthritis, and so on. But there is exception, such as inflammation of the lung is called pneumonia, and inflammation of the pleura is called pleurisy. Inflammation is divided into two main types, depending on the duration of the inflammation and the causative agent. There are acute inflammation and chronic inflammation. We start with acute inflammation. Acute inflammation is characterized by rapid, sudden onset, short duration, lasting from a few minutes, hours, up to the few days. And it is characterized by fluid and plasma protein exudation, with the formation of the edema in the tissue, and predominantly neutrophil infiltration in the tissue. Acute inflammation may progress into a chronic inflammation. When acute inflammation lasts for more than 2 weeks, it becomes chronic inflammation, as in neglected cases without treatment or due to the persistence of the causative agent. The main components of acute inflammation are 3 major components, which include vascular changes, cellular response, and humoral response. All these components are caused and induced by chemical mediators of the inflammation that will be discussed later on. We start to discuss the vascular changes that occur in acute inflammation. Vascular changes. There are a series of changes occur in blood vessels of microcirculation. Immediately after injury, there is a transient vasoconstriction. Then it is followed by prolonged vasodilation. Vasodilation causes increased blood flow into the area of inflammation, causing active hyperemia with increasing hydrostatic pressure. Also, there is increased vascular permeability. Increased vascular permeability causes exudation of protein-rich fluid, which is plasma. The combination of vascular dilation and fluid or plasma loss leads to hemoconcentration, with increased blood viscosity causing stasis of blood, which is grossly seen as vascular congestion and erythema or redness of inflamed site. With stasis, there is margination or pigmentation of white BC along the endothelial cells that line the wall of blood vessels. Then, transmigration of white BC and RBC across the wall of blood vessels by a process called diabedesis. Diabedesis means transmigration of white BC and RBC across the wall of blood vessels by amoeboid movement. This slide shows the major local components of acute inflammation that occur in the microcirculation and compared to the normal. Microcirculation is the end of the circulatory system in the peripheral tissue, and vascular changes of acute inflammation occur only in the microcirculation, not in the larger arteries or veins. The microcirculation consists of arteriole at one end, which leads to a network of capillary bed, and venule at the other end. The vascular changes of acute inflammation are: first, vascular dilation. There is dilation of arteriole, capillary bed, and venule, causing increased blood flow, and this causing edema and warmth at the site of inflammation. Second, exudation or leakage of plasma fluid and proteins, which lead to the formation of edema at the site of inflammation. Third, leukocyte, mainly neutrophil immigration and accumulation in the site of injury or inflammation. What is an exudate? Exudate is a protein-rich fluid, which is plasma derived from the blood. It accumulates outside of blood vessels, in the interstitial tissue or extravascular spaces. It is usually as a result of acute inflammation, and it is only formed in the acute inflammation. So, exudate is defined as an inflammatory extravascular fluid with cellular debris and high protein content, has a specific gravity of 1.020 or more. What is exudation? Exudation is a process leading to the development of an inflammatory exudate at the site of acute inflammation. So, the inflammatory exudate consists of: first, fluid, which is plasma; second, proteins, such as fibrin and immunoglobulins, in the form of antibodies; third, cellular debris, because acute inflammation causes destruction and damage to the cell of the tissue; four, cells. Neutrophils are the predominant inflammatory cell in acute inflammation, with a few numbers of macrophages, eosinophils, and lymphocytes. This is a picture of an inflammatory exudate in which there are numerous numbers of neutrophils within background of a fluid or plasma and a thread or meshwork of fibrin. Fluid exudation through the wall of blood vessels is due to the either increased vascular permeability, which is induced by chemical mediators of inflammation, or due to the direct damage to the wall of blood vessels. This fluid exudation leads to the excessive protein-rich fluid passes to the extravascular spaces, result in the formation of inflammatory exudates and edema. Thank you for your listening.